Good Friday afternoon. I'm Dr. Martha Buchanan, Public Health Officer and Senior Director here at the Knox County Health Department. Our moment of gratitude today is twofold. First, we want to acknowledge everyone, our coworkers, friends, and community members celebrating Juneteenth today, a commemoration of the ending of slavery in the United States and celebrating the heritage and contributions of African Americans in our country. And we also want to acknowledge the dads in our community ahead of Father's Day this weekend. Whether you have children or a father figure in someone's life, we want to extend our gratitude to you and hope you feel celebrated this weekend. Before I turn it over to Charity for the benchmarks, I want to summarize Wednesday's Board of Health meeting for those who didn't watch it. The Board of Health voted unanimously to adopt Governor Lee's Tennessee Pledge guidance effective July 1st. Until then, they voted for Knox County to continue to operate under the local reopening plan's Phase 2 guidelines. There are a few differences between the local guidance and the state's guidance, but they are similar, and the intent of both plans is the same. The public health intent of those plans is the same, reducing illness in our community as we safely reopen. If you're interested in comparing the two documents, we have links on our website under our main reopening webpage. In regard to the local benchmarks, the Board of Health voted to retain them, and it will be the Board of Health's decision on how they will utilize those benchmarks as our community moves through the reopening process. We continue to update these benchmarks weekly. We will continue to update these benchmarks weekly on our website. The Board of Health will meet every 2 weeks in a public format to review them as well. Additionally, information regarding their next meeting will be available next week. And now I'll turn it over to Charity.
Hello. First, we'll begin with our local situation. We have 632 confirmed cases of COVID-19 in Knox County. Additionally, we have 26 probable cases. 521 of our cases have recovered, giving us 106 active cases. 57 individuals have been hospitalized at some point in their illness, and 2 Knox County residents are currently hospitalized. We are thankful that we have no additional deaths due to COVID complications. Now we'll transition to the benchmarks. As a reminder, for the majority of our benchmarks, what we want to see is no 3-day statistically significant shifts within a 2-week time period. Every day we look back at the previous 2 weeks. That's what a rolling average is. Overall, what we mean by this is we are trying to see, are things staying the same or are they getting worse? And if so, how much worse and at what rate? Moving to the first benchmark, sustained reduction or stability in new cases for 14 days. To illustrate this benchmark, we have a bar graph that shows previous cases, new cases, and the growth rate over time. As the title of the benchmark states, what we want to see is a decrease in new cases or leveling out. Over the past 2 weeks, our new case counts have been stable. Because of that, this benchmark is represented as green. It's important to remember that cases are continuing to increase, so they haven't gone down, and COVID is still very much a part of this community. However, what we currently are seeing is a steady and small increase in cases, which our response is designed to manage and which our benchmarks are designed to look for. Our second benchmark, community-wide sustained and increased diagnostic testing with consistent or decreased test result reporting turnaround time. This week, we are not assigning a traffic light color for this benchmark because of some potential reliability flaws with this week's data for the first chart, tests conducted for Knox County residents. This is because of a recent change in the way the state is providing data. You may remember that they mentioned this in some of their previous briefings last week. Additionally, this is a significant data set with thousands of results to verify. We are working to create a new automated process to ensure a higher level of reliability moving forward. We expect to have this new process finalized by next week, and we'll assign a traffic light at that time. Again, the concern is only for the time frame June 7th through 13th. All the previous data is still accurate. We're just trying to incorporate the large amount of new data that we have and make sure that we are counting it and utilizing it in the same way that we have been doing previously. Anecdotally, though, reports from our testing partner agencies, hospitals, and private partners, including our own testing, does indicate that this data is in good shape and consistent with previous weeks. So we're not concerned about it, but we just want to ensure that our data that we're showing on our website and that we're judging our benchmarks on is reliable data. In regard to the second chart on this benchmark, the average time between specimen collection and lab report data, the time frame did increase slightly, but this does not register as statistically significant. However, we are keeping an eye on this. This graph would meet the qualifications for green if we were assigning a traffic light color this week. Our third benchmark, sustained or increased public health capability. For this benchmark, we aim to reach out to cases within 24 hours and close contacts within 48 hours. And to date, throughout this pandemic, we have accomplished that for all of our cases and contacts. And because of that, this benchmark continues to be represented as green. As a quick note, we did update the chart under this benchmark that details the individuals involved in the public health response to simply show the numbers of individuals currently involved in our epidemiology support team. We are working to restore some of our routine services that have been temporarily suspended so staff could focus on the response, per our continuity of operations plan. This means we are now working to retool how we staff our epi support teams. To advance these efforts, we are also working with the Tennessee Department of Health on staffing alternatives to provide services for the response. More information is forthcoming on the local contact tracing capacity beyond our core epi support team. However, with all of that said, our current team is still able to contact cases and close contacts within the build timeline of this benchmark. Our fourth benchmark. Healthcare system capabilities remain within current and forecasted surge capacity. These graphs show the availability of regional hospital beds, ICU beds, ventilators from our hospital partners. It also shows the additional surge capacity for these categories, as well as the COVID positive patients and patients with pending test results in the hospital. These data are gathered from the information hospitals put into the Tennessee Healthcare Resource Tracking System, or HERTS, and it may reflect Knox County, East Region, or patients from other jurisdictions. For this benchmark, the traffic light remains green. However, we do want to note, while the numbers of COVID patients in hospitals are relatively small, they are continuing to trend up steadily, and we are watching this very closely and talking with our hospital partners about this. As always, decisions regarding how to classify this benchmark as green, yellow, or red are made in concert with our hospital partners, as well as taking all of the data into consideration. And our fifth benchmark, sustained or decreased COVID-19 related death rate for identified positive or probable cases. For this benchmark, we show the chart that details cases, hospitalizations, and deaths. This benchmark remains green because we thankfully have not had an increase in deaths. And now we'll open it up for questions.
All right, please go ahead and submit your questions into the chat feature. And as a reminder, please type in your name and the media outlet in which you're affiliated with. Switch over our screen here. Okay. Thank you for your all's patience as I get up to date here tech-wise. All right, so first questions that came in is from Paul with WBIR. Let's see, this one is, you told the Board of Health that the hospital benchmarks are regional. What other counties does that include?
Yeah, I'll let Charity do that.
Sorry about that. That's Knoxville and the 16 county region that surrounds us. So I will not be able to get them all. I think it's like the 7 dwarfs and I always miss one. But it goes all the way up to the Kentucky border. It goes to Roane County and Morgan County, goes south to Monroe County, and then goes east to Campbell County area. And that circle around us.
His follow-up question is, Sevier County has reported 8 new hospitalizations since June 4th and continues to see a rise in cases. Does that rise concern you, being a neighboring county?
Oh, of course. And again, like we said, we are seeing an increase in hospitalizations and are watching that very closely. And again, it reiterates that this virus is still very much present in our community and that we need to still follow the 5 core actions throughout to try to protect our neighbors so they don't end up hospitalized.
From Megan with WVLT, Dr. Fauci recently stated that football may not happen despite the NCAA releasing plans for the upcoming season to proceed. Will the health department have a hand in helping officials at the University of Tennessee make a plan for allowing fans to gather inside large venues like Neyland Stadium or Thompson Bowling Arena safely?
I think that we work very closely with our partners at the University of Tennessee. We talk to them all the time, and they can come to us with questions. We also always recommend that they follow the state and federal guidance and their other regulatory guidance for that. So I think that those communications and conversations will happen as we move forward throughout the summer.
From Paul with WBIR, what are the biggest changes between the Tennessee Pledge and Phase 2 that are not mask related? Dr. Buchanan will come up here.
Sure. So as you can imagine, both plans have a lot of detail in them. And so there are some, you really just have to look at those to compare them. And I couldn't name all of the differences, but there are some differences about requiring masks or not requiring masks. Those are some differences. Advising restaurants to take temps and ask patrons about symptoms. That's in the state plan. That's not wasn't in our local guidance. So differences like that. But like I said previously, the intent of both plans is to help businesses open safely and protect the public. So the public health intent of both plans is really to protect our community and enable businesses to open safely.
From Madison with WATE, are you concerned that other counties following the Tennessee Pledge are showing a spike in cases?
I think we see changes in across the state in the number of cases that are happening. And remember, only 6 counties are following. There are 6 counties that are allowed to have different plans. Nashville and Davidson County and Shelby County have their own plans. So it's not just in places where the Tennessee Pledge is being followed, where cases have increased. So it's not limited to those counties. It's occurring across the state in different places.
From Paul with WBIR, is there a concern that Knox County hospitals may be burdened by cases from other counties, handicapping our capacity to treat Knox County residents?
We do look at that. So when we report our daily numbers of hospitalizations for Knox County residents, that is just Knox County residents. But when we talk with the benchmarks, that data is regional hospitalizations. So that's all patients, whether they live in Knox County or they live in any other county, they're in any of those 19 hospitals in those 16 counties. So it's included in what we're talking about and analyzing every week.
From Madison with WATE, will restaurants required to take guest temperatures be provided with the tools to do so?
So restaurants will need to look at the guidance and make those business decisions on how they're going to accomplish that internally.
From Paul with WBIR, how many business complaints have you received to date? And we can look up that number for you and get that out via email after the briefing. And does it concern you that the Tennessee Pledge has no method of enforcement? Well,
honestly, as we've talked about before, the tools that we have are limited with enforcement. Really, the tool that we have, the main tool that we have is education, informing the business owners and the restaurant owners and others what the guidelines are and providing them guidance on how they can accomplish that. The other tool we have is people wanting to do the right thing. And that stays in place no matter whose guidance we're following. So neither plan had any actually enforceable violations or fines associated with it, but really relied on people to understand it, use it, and do the right thing.
From Megan with WBLT, a recent iOS update included a feature called COVID-19 exposure logging. Is Knox County Health Department working with cell phone companies to utilize this new technology?
We currently are not.
From Madison with WATE, what process changes are expected for some businesses in the adoption of the Tennessee Pledge?
I encourage you to read both plans and to see what those process changes are.
From Paul with WBIR, Memphis is implementing fines for people who do not wear masks in public because health leaders say not enough people are wearing them. Would Knox County ever consider that?
That's something for the Board of Health to take under consideration.
From Scott with Compass, does Knox County retain the ability to opt out of particular aspects of the Tennessee Pledge? For example, can Knox County still place different standards for gatherings?
That's again a question for the board to decide if they so choose.
From Paul with WBIR, has the health department or county been threatened with lawsuits for your reopening plan?
I'm not aware of any. That's a question for the law office.
From Brian Hornback, what are the terms of the members of the Board of Health?
I believe it's a 4-year term, and that's outlined in the Tennessee Code, and they are all nominated by the professional organizations and then approved by county commission.
His follow-up questions are the members' terms on rotating basis, who appoints them, and when is the next appointment period, which would also be in that Tennessee Code as well.
Yes.
From Paul with WBIR, how many contact tracers do you have, and are you concerned about needing more, and do you need the money to fund them?
So what we're working on right now is we have 30, I believe it's 38 on our website that's working for our response right now, which are more than enough. One of the things that we were talking about that I mentioned with forthcoming information, but I can give you a little preview. Tennessee Department of Health is moving towards a centralized daily monitoring process for cases and contacts. And we will be participating in that, and we'll be actively moving into that over the week. So we will still do the initial investigation and contact tracing, but it does move all of the daily calls that we're making to check in and get statuses on folks to a more centralized format, and then they report back to us to follow up with any issues or concerns. So that's going to take a large burden off of our staff who've been doing all of that right now. We have some other irons in the fire, so to speak, that we're working on to bring additional team members on board to help support investigation and contact tracing efforts. We just haven't gotten those to a finalized point yet. We'll talk about them when we can. But I will say that overall, our team that we have right now is more than sufficient to respond to our current caseload as it stands now, and that's even with the daily monitoring.
From Madison with WATE, how does implementing the Tennessee Pledge impact Knox County Schools reopening plan? And if so, how?
Actually, I don't believe it does. I believe schools are falling under the Department of Education and following their guidance.
Also from Madison with WATE, what are the next steps in implementing the Tennessee Pledge? Does the Board of Health report the choice to adopt the Tennessee Pledge to the Economic Recovery Group?
I don't know. There's no reporting requirement to the Economic Recovery Group. The next steps really are to what we'll be doing over the next couple of weeks is doing our best to figure out how we are able to support businesses as they make that transition.
From Vincent with the Sentinel, what specifically in your interpretation of the law transfers authority to make decisions to the Board of Health over to the director of the Knox County Health Department? That appears to be a departure from the KCHD pandemic plan and the statewide pandemic plan.
It's a great question for our law office, as that's their area of expertise. From
Scott with Compass, what has been the reaction of businesses to the switch of the Tennessee Pledge?
I haven't heard anything. Some of our staff may, probably mixed, but I haven't heard anything specific.
His follow-up question is, what are your plans to inform businesses of the change?
So we'll be pushing information out through a listserv. These press briefings, all the things that we've been doing through the whole time. The listserv won't be going away, we don't think.
From Tyler with the Sentinel, he says, sorry if this has previously been answered, but will law enforcement change in any way? Not will law enforcement, but will enforcement change in any way under the new state plan?
No, enforcement will remain as it is, which is mostly education.
From Paul with WBIR, are there any frustrations or pain points you have noticed while battling this health crisis?
You know, it's all new and challenging. We're really busy. Time is one of those frustrations that I bet we all have from occasionally when things are really busy for us. And helping people understand and communicating. Communication is so important during any crisis, and understanding people are frustrated. Whether you own a business, whether you're somebody, a case or a contact, or you're just somebody who's trying to live their life right now, people are frustrated and sometimes confused. And so one of our challenges always is to get good information out there and one of the reasons we have these press briefings is to try to answer those questions. So our biggest challenge, our biggest goal is to educate and inform and enable our community to safely reopen and continue to do our job in the response side also. So reopening is a part of what we're working on, but the other side is the response side. Reopening is different for us